wanted to sort of throw out for all four of you the opportunity to maybe address what you think is the most misunderstood component of how blockchain could be applied to healthcare. Of the sort of rumors and concerns out there, which one of these do you think is the worst off, and which one of these do you think people actually don't understand nearly as much as they should? And maybe we'll start with you, Dan.
Oh, sure. Well, let's see. I guess one thing to keep in mind is there's sometimes confusion on whether one should be using a blockchain or one should be using a database. And there's this question of, what type of data requires what type of technology. So I hope that we can clarify that in this discussion in your mind. If it's data that doesn't need to be replicated, or this idea that modification to the data by adversaries is not something that you worry that much about, a database is actually something that's perfectly fine to use. If you are worried about replication, if you do worry about integrity, longevity, provenance, as was said before, then that's when you should consider a blockchain. But I think it is, every time you think about where to store your data, I think it is very important to ask yourself the question, do I need a blockchain or do I need a database?
Great. Katherine?
I would say for us, and what we hear often is that you don't put data or large amounts of data on the blockchain. So that's where that key pair is really important, or that identity is really important, is being able to access large amounts of data that potentially sit elsewhere. Electronic medical records should not go on the blockchain. We got a lot of questions right around before GDPR went live. GDPR is a type of new privacy protocol where a patient has the option to ask that their data is not retained. So a question we often got is, well, if healthcare data is on the blockchain and it's immutable, then doesn't that not work with GDPR? And our argument is actually that a blockchain technology is quite beneficial for GDPR because you can actually track who's accessing it, when they accessed it, and you don't have to worry about not being able to delete the data. So ours is really, it doesn't go on the blockchain.
I love that. That's actually true, right? I mean, I agree with that. I think you put the permission key on the blockchain, not the data.
Exactly.
Marsali.
So it goes to verify, manage, and control. Who's going to verify the people and the roles so they can link? Who's going to manage that component? And if something goes wrong, how are you going to control? And then you also have the right to be forgotten. Mm-hmm. So you have to think through, if European citizens have the right to be forgotten, how do I forget them on the chain? So what does it be?
So you think it's all compatible and doable on the blockchain?
I think there are components with trust block. It's absolutely possible. You have to manage those components. You have to be able to dial in. So the commitments, what it is you actually put on the chain, and how you manage the identity of the person who wants to be forgotten, that's...
Actually, can I add a quick note on that? I think what you hit on, both of you, is a really, really important point, in that what actually goes on the blockchain is a commitment to the data, and I think it's important to know the word commitment. Commitment is a cryptographic concept, which basically says you can have a huge amount of data, it could be gigabytes and gigabytes of data, that you can compress into a really short string called a commitment that binds this gigabytes of data to this really short string, and what you put on the blockchain is actually just the short string. So the data is now, you're committed to the data, but no one actually can recover the data from that short commitment.
Is that the same thing as a hash key? Or how does it relate to a hash key?
It's, you can implement a commitment through hashing, but you have to do a little bit more than just hashing.
Okay.
Yeah.
Thanks, Dan. Jillian?
This goes to that point, too, because, the human genome is, 500 gigabits, right, of data? That is, in order to put that onto a blockchain, it basically has to be stored in sort of metadata, excuse me, and index files. And I think that people are really misunderstanding that it's not all placed on the blockchain. I'll probably die here on the stage. They're blockchain.
Yeah.
You don't have like the flu or something.
No, I
do
don't.
Okay. But I think that's a great
Trust but verify.
Yeah. That's a really big
I got your DNA
misunderstanding.
now, Jillian. Thank you so much.
I don't know if you want it, but if you want
I
it,
do,
how
I
much
do.
do I get for it? How many
We'll
DNA
sort that out
tokens?
later.
Right. You know, that's one of the big misunderstanding is how much gets uploaded, how much can I control, what part of it, and this is going to be an answer that's going to reveal itself because we don't even have those answers. But I think your point in terms of what do we retain, what do we put up there, can we, and you can't really change it. I think the answer to that question is tenfold. Every answer reveals another question.
One of the other sort of futuristic Black Mirror kind of questions that I can imagine is in the audience's mind. If we think about the future value of data, okay, and I like to make the argument, and you heard me make the argument, that 99% of the data I want in 2025 hasn't been generated yet. It'll come off of people's consumer devices. Is the compounding value of people's data streams going to be the basis by which, say, you implement something like universal basic income, so that folks that need to be compensated will get compensated by data sharing? Or do you think that's, bogus and bullshit, or, or somewhere in between? Maybe Dan, I'll start with you again.
Oh man, there's okay. So first of all, there's definitely quite a lot of work on compensating people for contributing data. Actually, before I get to that, I'd like to mention this cute thing that we're doing with the registrar here at Stanford, in that when it comes, so you talk about protecting data and so on. One of the things we're discussing with the registrar is actually putting Stanford transcripts on a public blockchain. And the cool thing about that is that even if for some odd reason Stanford disappears in 50 years, people will still have their transcripts on a public blockchain that anyone can verify and can show that it's the latest version. In fact, the transcript is the latest version that is being presented. So that's kind of a very good, interesting application for protecting data. Now, in terms of how do you compensate people for data they provide, there's actually a lot of interesting ideas in that space. One of the most interesting ideas is essentially, so imagine we do what's called federated learning. So federated learning means that we all keep our data locally. So I keep my healthcare data to myself. You guys keep your healthcare data to yourself. But somehow there's a sort of protocol that runs among all of us that uses our federated data to produce a machine learning model that can then be used for other purposes.
That's what Doc AI is doing.
Yeah, it's actually,
exactly.
Believe it or not, this comes up in like 7 different verticals.
Yes,
it's the exact same problem.
Absolutely.
So there are lots of, I just give healthcare as an example because we're at a healthcare conference, but this comes up in a lot of different 100%. Contexts.
Yeah,
so we want to keep our data locally, but run a federated machine learning algorithm that processes the data without us actually exposing our data in the clear. Now the question is, how do you compensate people for their contribution to the model? And there are a lot of interesting ideas here. One of the I'll just throw out one idea that's come up, which is to say, for each one of us, you can kind of run the machine learning model with everybody's data, and then run it again with everybody's data except my data, right? Now you have 2 models. You can measure the difference in quality between the 2 models, and the bigger the difference, the more I get compensated. Absolutely. Which means that I get so the more valuable my data was for the machine learning algorithm, the more I get compensated for that. And that is a formula that you can literally evaluate how good the model is. That dictates how much I will be compensated for my data.
For those of us that are worried about the lack of diversity in genomics, this is perfect, right? No, I mean, if 95% of studies have only been done in populations of European descent, what is the marginal value of an extra European genome, right? Probably little compared to the ability to sequence genomes in places where you're going to find high associations that you've yet to fish for, right? So I think that's a perfect idea.
Right. Right.
And in fact, I mean, I would argue that in many ways, the fairest thing to do is to compensate people for their contributions in exactly this way. There are a lot of ethical debates about when you do research, how do you incentivize people? Are you doing coercion? But in reality, as people are modern, they should be compensated.
Well,
right?
you look at what Vitality is doing, which is a UK-based insurance company, right? And what they're doing is they're incentivizing good health, whereby you opt in to their plan, their insurance plan, and you agree to wear some sort of device. And it would monitor...
Human Geico.
Yeah, it's like a human Geico. And so basically, if you hit the exercise milestones every day, if you take your medicine, if you do all these bits and pieces, your premium is lowered and it continues to be lowered. Now, I think that is super smart. Needless, like in a car, if you enable some of the insurance companies want to put sensors in your car so that you're driving slowly, so that you're not misbehaving in your car, and so I think it's incentivizing, and I think that's how to gain value. Completely. But what I'd really like to see, Carlos, and I'm going to go on the wee tangent.
Go.
Okay, can I
Tangent away.
Tangent away? Okay.
If we can have moose on a boat, you can tangent away.
Actually, this is my moose on a boat. This is the moose, the mouse. This is everybody on the boat. It's an ark. So this is my ark. All right. So I think, and I'm creating a TED Talk on this, all right?
Go for it.
I call it the good behavior token. And I really believe that the way to incentivize society to actually act better, to invest more into each other and themselves, is actually to reward them with what I call a GB token. And so if you were at an Airbnb and you were a good guest, you would get a GB token. If you are hitting your activity milestones a day, you get a GB token. For whatever that you do, right, you would get a token. You would amass these tokens, and that token would then be used for things like credit, creating credit. Because even though you may not know this, but there is a strong correlation between how your wealth responsibility and how you're responsible for your health. People say if you invest in good health, you actually invest in long-term stability in terms of wealth. So there's direct correlations. I think there's a new FICO that has to, people talk about FICO being indicative of your health. Do you know that? Your FICO score? It's fascinating. So I'm really thinking of it as a broader term in terms of where we can not disrupt, but create different foundations of credit, of health, of good behavior using that value.
So I think you're talking about what do we value and how do we monetize or reward value. And then my question in that is whose values and how do we agree on those? So there are some systems in some countries where you have a citizenship score. Right. So this is where with IEEE, I do the child and student data governance in their artificial intelligence and autonomous systems. Because it's the ethical, what are the ethical considerations and what do we need to build into our code, into our processes to allow for choice and to allow for community. How do we both protect people and how do we reward good behavior? So this is the yin and yang. Now I do want to tell you.
How does the good behavior token not turn into a social score?
That's right.
Well, yes.
That's right.
You're right. We haven't figured that out yet.
Well,
Distributed delegated
when Peter
data.
Thiel was out here, he, I think, very provocatively said, right, blockchain is democracy and AI is totalitarianism.
Somewhere
Right.
is
Discussed
federal.
amongst
Yeah,
yourselves.
we need
Yeah,
to
right,
federate
right.
it. I like
And where
the
the
federated
intersection
idea.
Where's the
lies.
no, but it's
Where's the
true.
intersection lie?
It's
Completely.
distributed delegated data that people get to select what they put on, and then you can manage your permissions. If we have to all agree on something, it will be forever in the talking pace. So until we can have the ability, it happened in finance, we can do derivatives, right?
Yeah.
So my values don't have to be yours, but there are some things we agree on. Between all of us, we have things. So if we can do that with data, and we put on provenance. Now, I play the violin. I have this old violin. It's lovely, it's beautiful, but I don't know who made it. So I don't have provenance. If I knew who made it, I couldn't afford it. And I believe that's what data will become. If we allow people to create their own amount of provenance they're willing to share, then we can create values on different ways that we use the data. So you all have good philanthropic reasons, but let me tell you, there's an entire dark web of criminals who love your data, and they have a lot of reasons to use it. So with the Global Information Commission, I work with nation-state leaders on why when we connect the pipes do all of a sudden we have cybercrime abuse and exploitation. It's because the web is designed to find the newest people and take advantage of it.
To bring it back to healthcare, actually. So I was once, and I'll open up in a second to the audience. So I was at a conference recently with the head of purchasing for oncology at United. And he said, Carlos, I don't know how to reimburse an oncology panel test, because by the time I get the panel test, I don't know what genes are on the panel. I don't know why the test was ordered. I know why the CPT code was chosen is to maximize that I'll reimburse, right? I don't even know why I'm paying $1,000, $5,000, or $20,000. So I'm just going to deny it, right? And so if I had data provenance, boy, that would be a far different world in which we could live. So
You have a Stradivari.
Yeah, absolutely.
And that data is exactly what you wanted. What you wanted to play on, you're going to pay for it.
Anything else on the panel before we open it up?
So what I would add is that we talked a lot about individuals, which in universal basic income, but you could actually change this into different verticals and different jobs. So now that you have the data open, you can earn tokens for cleaning the data, which is a massive pain. If you're a data analyst, this is talk about a gig economy. So you can clean the data, you can get access to analyze the data. One of the hardest things for us to get as a startup was clinical data to test our first platform. I would pay money to get access to that data so that we can test and build algorithms before we went to our first customer. So being able to open up your data isn't just for you personally, but it actually allows you in whatever your career choice and career path is to be able to create that opportunity to kind of turn it into a gig economy. And so that's why we really focused on that key pair and the broader marketplace and the infrastructure is to be able to create that opportunity for more of that gig economy. So yes, as a person, our data is really, really valuable. For example, we already know that one de-identified oncology record goes for $1,500. That is being sold right now by a company in New York City. So there's a lot of value in that individually, but there's a lot that collectively we in healthcare can bring to access to that data.
I can get you de-identified oncology records by 3 o'clock. You don't even want to know. All right, let's open it up to the audience
I
members.
like that.
Sir.
I think it's a
I like
gigabyte
that.
community.
Oh, nice. Yes, gigabyte.
You can
community.
self-select your communities.
We do a lot of skills marketplaces. We invest a lot in the gig economy. So I really like that.
Yeah, we have
Glad
good
you're
lines.
thinking on that.
So question from the audience.
Hi, thank you very much. So there was a lot of, I guess, need for identity and trust. Now, in the industry or academia, there's lots of models for self-sovereign identity and trust that are evolving, not necessarily all consistent, and I'm sure that'll evolve. So from the EP3 and other perspectives on the use cases, do you have a sense of what you want from the definition or notion of trust and identity in context, and how will you deal with the evolving nature of the foundational block there?
Absolutely, thank you. I did not prompt that, okay, just in case you're wondering. So for anything to be successful, it has to be dynamic. You have to be able to have choice. You can't force people to agree on everything. And you have to allow your own trust criteria. So by taking large data sets, and we do have companies with enormous amounts of data in our pilots, and it's already been tested and proven. So my paradigm is, and it's really Jonathan Hare with WebShield, he thought of it 10 years ago. Same time cryptocurrency, but you only need 2 people on a node, and you're off and running with your currency. But with a marketplace of data, the value of data, my provenance violin, I have a cheap violin, I don't know the story, but if you have data with provenance, so you have to have these big data sets that then people are willing to share a tiny bit of information. It creates the authorization network. Within that authorization network, you can run your privacy domain, your own, and you can have a global privacy domain. You can have your own licensing and payment, so you can facilitate that. So the newest people on the web can immediately have their own value in the web and in their community, and not just be victimized. I call it a data Carta. You know, we need a data Carta.
A data Carta, I love it.
Yes, data Carta.
All right, now I want to call out my friend the wizard, Jonathan, as I call him, the guy who's honestly responsible for me sort of proposing this. Jonathan.
All right, thank you. Gosh, I didn't know. I have to tell my mom I'm a wizard.
Totally a wizard. I can.
Totally, right? Isn't that
Yes,
right?
the most.
He's kind of
brilliant
tall
person.
like a wizard.
I
He's like a
think
young
these-
Gandalf.
He's brilliant.
And it really comes from actually Dan Boneh, because as you may recall, I think it was 12 years ago, I somehow managed to get Marty Hellman to invest in one of our other companies, Resilient. And he explained every flaw in security as it exists. And I said, how do people sleep at night? And said, well, if they understand security, they don't.
They sleep because they don't understand.
Because they don't understand, right? Ignorance is bliss. Yes.
And so I said, well, do you know anybody who might understand how to solve this problem? Because he's a mathematician, not a technologist. And he said, well, you meet my best student ever, Dan Boneh. Now, I'm glad you talked about blockchain, and that the topic here is big data and precision health. Because if you think about blockchain, it is a foundational technology that will be pervasive. But if you think of sort of the simplistic narrative people get about the blockchain is, rather than something tied to enterprises, every person can get personal control of their own data. It will be cryptographically secure, and I'm not sure what that means other than totally insecure, like if you lose your key, what happens? Yeah. And then all will be well with the healthcare system, right? Sort of like Microsoft Health vaults, which are all empty, but at least you control it, right? But if you think what's really necessary to do big data and precision health, the question is like, do these patients, do they know where their healthcare records are? How do they get this highly regulated, sensitive data that people review as proprietary onto this blockchain thingy, link it all together and reconcile it so it's meaningful with provenance, so you actually understand whether you can trust all these data sources, and then how do you transform it into all the myriad sort of data models and assumptions about provenance, so, for whatever user interaction or big data analytics. And then your authorization model is you get permission from each person who can see which attributes, because don't you realize we need comprehensive longitudinal profiles of all people and then globally aggregate them to do this, basically a giant data ocean in the sky, analyzing all data and then interact with people in real time without any selection bias. So that's actually the simplistic narrative around blockchain, supposed proof of trust blockchain, is the polar opposite of what's actually necessary to do precision health, or actually anything meaningful in the real world that involves interacting with the real world and other people. So it's really more of a key and secret management. There's a whole bunch of underlying problems. You actually have to satisfy them all on a global scale, or it just won't function. But have you been making any progress in cryptography around key management and secret management to get globally trusted, root of trust, so you can trust all these different components?
Yeah, actually, there's a tremendous amount of progress in key management. I mean, there are systems like Connex that are being deployed at Google and such. Definitely, I mean, key management at the end user level, of course, is still considered a fairly difficult problem. But there's, like I said, there's tremendous amount of progress on it. Now, when it comes to you mentioned what happens if the user loses his key. There are systems like, or there are capabilities like, multi-sig approaches where, to access your data, it's not just that you need your own secret key, you need your secret key plus somebody else's secret key. So even if you lose your key, whoever stole it will have to convince this third party that they are you in order to access your data. So there are kind of other backups that you can build into the system. And this is actually all comes up in the application of blockchains to finance. If you're if all your wealth is tied up to your controlling a secret key, obviously it's exactly the same problem as if all your healthcare data is tied to a secret key. And so everything that was developed in the world of finance would apply equally well to protecting healthcare data. And there's a lot of tools in the finance world that has been developed. Finance, I mean, in the cryptocurrencies world, that has been developed to protecting people's secret keys that are tied to their own wealth.
So you're optimistic.
I'm optimistic. Absolutely, I'm optimistic. I think this can be solved.
Jillian?
First of all, Mr. Wizard, I thought that was actually really, really great distillation of exactly the challenges that we're all facing. Because the fact is, although I'd like to believe that this, and I truly believe this will happen, we are so far off and far away from all those bits that you mentioned all those steps from really being able to be realized. And so the fact is we're trying, and you're building, but we're really at the very baby, we're at baby steps. And yes, Cerner and Epic are still holding most of our data hostage. And I don't know how we're ever going to take that but we're creating new data. We're using, and that's really where that's their starting point.
It's all about the data nets. Again, if most of the data I want hasn't been generated yet. It's how you do this prospectively. And I'll say, Jonathan, you won me over when you said to me, look, don't you realize most of this data already lives on Amazon Web and on Google?
It's now, it's not later.
And so if I've got a JSON file, all I got to do is slap on a hash key and we're good to roll, right? So maybe it's not that easy, but as we've centralized a ton of the storage and as we think about prospectively what's happening, I am optimistic that this can get built, right?
I don't think it's that far out.
I don't think it's that far out at all.
I think the full management and applications are. But then on the other hand, I didn't know if you saw, but the WEF noted that in 2027, the GDP, 10% of the GDP will be on blockchain. So that is, we're galloping towards that. I believe for full global adoption and the build of all the different applications, I think we're a bit off.
Well, you're wrong.
I would say trust block. I would say trust block is here and now. All of the
Okay, well, you know what? Maybe my far off is not your far off. Yes. So there we go. Maybe, are we thinking 10 years, 5 years, 20 years?
10 years ago, we were 10 years away.
Yeah. The trust block is
we're organizing a paradigm around enterprises. Everything's around key management and systems around enterprise, which is what everybody in this valley and the globe is doing.
Yes.
You'll never get there. You could wait 1,000,000 years.
Yes.
So if you take the same components, you organize around a global trust model, organize around individuals and provenance and data and so on. If you just refactor the model, very hard problems can become simple.
Quickly.
We waited 1,000 years before Marty Hellman invented public key encryption.
So
made no progress, and in 3 years, we solved it.
Katherine.
So I actually have a different perspective, and a lot of this comes from, I taught on the Texas-Mexico border where a lot of my students didn't have roofs on their houses, they didn't have electricity, and they didn't have running water, and they also weren't recognized by the government, not because they weren't born in the United States, but simply because their zip code was not actually identified by the United States. So I actually think that it's a combination of individual and enterprise. Don't zap me, wizard. And the reason why is because if you actually look at the individuals at this point in time that want to manage their own healthcare data, they're the top 1% of those that are actually really healthy, and they're actually not costing the healthcare system a lot of money. They're the ones that are pretty good stewards of their health already and pretty good stewards of their data. I'm actually more concerned about the 7th grade students that I taught, who it was so hard to teach them about anatomy and physiology at 7th grade level because they didn't know if they were going to have dinner on the table at home and whether or not they were going to have electricity. So I actually think it's really important that the individual and the enterprise come together to create this trust network. Otherwise, it is going to take a very long time, and so our approach is really bringing both of them together.
We have one company that's not health, but we have one company invested in called Neighborly. It's a municipal bonds on the blockchain. So you can invest in your community. You can invest in solar panels. You can invest in parks. You can invest in bike paths, not just in your community, but all throughout the United States. And I thought, so yes, these are being built. Yes, they're up and going. And so Gandalf, wherever you are, yes, Jonathan. Perhaps we're not that far away, but I'm okay. Maybe you've changed my mind. Wherever you
By
are.
the way, I have to say this is why this is such an exciting time. I mean, there's a lot to build.
Yes.
A lot of infrastructure is still not there that needs to be built. This is why this is such a wonderful area to work with. And I have to tell you, like every single one of those questions is a fantastic research problem for us to work on.
Yes.
Which is
Well, this is why I say,
absolutely.
As sitting here at a university with access to the talent that we've got and that is coming, I mean, I just think it's an extraordinarily exciting time. And, we're starting at ground zero, right? There's tons of opportunities for folks to jump in, both with domain knowledge and on the engineering side, because these are some of the fundamental problems of our times. Last question, Chief.
Thank you. So while we wait for blockchain implementation, right now folks here in the Stanford area can access their information via Apple. on their iPhone. How does that affect what the blockchain will look like and what the Apple vertical will look like in the future?
So coming from hospital administration, there are specific pockets of data access. So some of those very good pockets of data access are places like here, Kaiser, Boston, where the health information network exists because it's such a competitive area that a lot of the hospitals actually have their own risk pools. And what I mean by that is you as a patient are highly incentivized to stay within their network. In Boston, for example, Partners Healthcare is known in the entire New England area for being terrible at sharing data. So much so that that model that I had on the screen, I actually proposed to the entire state of Massachusetts because Partners is so bad at sharing data. You actually create a trust network and you can point out the fact that Partners is not sharing data. But those pockets don't exist everywhere. Oklahoma, you're not going to be able to get that same access to data. So the fact that Epic has that data, if you were to leave that network, if you were to leave Stanford's network and you were to go to a mom and pop physician who has Athena Health or, God forbid, paper, you're not going to have access to that data. And so blockchain gives you that, with that key pair and the cryptography and the trust, access to that data in silos that will continue to exist in healthcare.
We have access to data here in this area, but we do not have comprehensive. Even if you're on Kaiser, your behavioral health, if you have a psychiatrist, it's not going to show up in your app. It won't show up on your phone. They don't mix it. So you have to do a separate, NetSmarts has to come in and create a wraparound for behavioral health, because we've just been through this in the county. The big issue is we can't talk to each other because there's not one system that allows you to talk. So it's another reason why if you have some health data on your phone, but you could not do comprehensive whole person care, you could not take care of Maria Gomez, and you cannot be Maria Gomez.
And Epic in Stanford does not talk to Epic at Yale.
No.
It's the same vendor, but they're entirely different.
Or Lucille Packard. So if you're 17 and now you're 18, sorry, you don't have access easily from Lucille Packard to Stanford. There's no easy handoff, because I'm in the weeds in this right now with our own county. So it's, anyway, thank you though.
I would encourage you to look at MediBlock out of South Korea. They're really ahead of this, and they're working on Doc AI in terms of the mobile piece of this and the data off the smartphone and how to coordinate that. But once again, that's in South Korea. That's not here in the United States. And
You have to get the data.
Yeah,
You have to get it in.
Yeah,
and you have to be able to aggregate it.
Right.
Never my Palo Alto fountain, you know.
So this is more questions is basically being raised.
So I want to thank you all for coming out to talk to us. You've left me speechless, which is rare. So thank you.